Hello, welcome to Medicine with Sadan. Today we are going to learn how to do a cardiovascular examination. The prerequisites are the same, such as we sanitize our hands, we introduce ourselves to the patient, we ask for consent, we place the patient at a 45-degree angle, and we expose the patient. For cardiovascular examination, the shirt should be off and the trousers should be above the knee. जी अस्सलाम वालेकुम, क्या नाम है?
रजब अली।
मेरा नाम डॉक्टर फैजान है। ठीक है, मैंने आपके दिल का मायना करना है, इस दौरान की तकलीफ नहीं होगी। अभी कहीं दर्द तो नहीं हो रहा आपको? ठीक है। अच्छा, ये शर्ट उतारेंगे अपनी। Since he is a normal subject, I am going to proceed with the minimum exposure for the sake of his dignity. Now we take a careful inspection from head to toe, and keep in mind that this is not just for the sake of showing to the examiner. We need to inspect the patient with the eyes of a detective. So, first take a superficial inspection from head to toe, looking for any respiratory distress, any pain, and then come to look at the precordium and look for any scar mark like any mid-sternotomy scar, any visible pulsations. Even apex bead might be visible if you take a good look. Now you can either examine their peripheries and then go on to examine their precordium, or you can straight away examine their precordium and then do the relevant peripheral physical examination. You can adopt either of the two methods depending on your local exam or your preference. But in real life, or especially if you are practicing in European countries, the first method is preferred. The reason is it might be a routine for you to examine patient, especially when they are exposed, but it is not for the patient. So you need to build a rapport with the patient first, because you see they are presenting their dignity to you. So the routine then becomes a ritual and you need to do it religiously, right? So I will do this examination following the first method. जी हाथ दिखाएं ऐसे. You look for any pallor, any stigmata of infective endocarditis, and at the same time you can pinch their finger and measure capillary refill time. हाथ इस तरह करें. You look for any cyanosis, peripheral cyanosis. Look for any digital clubbing. Look for any connective tissue disease or bony deformity of the hand. Then right here, I would recommend to look for any signs of previous stroke. And we can do it by asking or looking for pronator drift. I advise to do this step right here because at the end of the examination, you might forget to do it. Also, it might save time because you are already at the peripheries. So I would suggest to do it right here. अच्छा, इस तरह करना है आपने. आंखें बंद. ठीक है. Now we are going to assess the pulse. While assessing the pulse, one thing to keep in mind is that the pulse rate is not going to give you any clue to the heart condition. So you do not really need to actually calculate the exact heart rate. The things that are going to help you in diagnosing the actual heart pathology are the character of the pulse, the volume of the pulse, and the regularity of the pulse. G. And also, you need to tell the patient every step of the examination, whatever you are doing. मैं आपकी नब्ज देखूंगा आप ठीक है. And at the same time, you can also get a clue about their respiratory rate too. Now assess for radio-radial delay. And if you are doing the scheme in the real exam, then you can at least offer for radiofemoral delay. For the sake of his dignity, I'm not going to do that. Now you proceed to look for collapsing pulse. And the correct way to do it is you place your palms like this and feel the radial pulse with the basis of your fingers, right? And you ask for any pain in the shoulder. कंधे में कोई दर्द तो नहीं है? Now you slowly raise the patient's arms. And if there is any collapsing pulse present, when you bring the arm at this position, the pulse, the radial pulse, will start feeling like this bounding. This phenomena is called collapsing pulse, and it is seen in conditions like aortic regurgitation or high volume states, even mitral regurgitation too. Now we assess the patient's JVP. As he is already at a 45-degree angle, so we do not need to make any changes in his position. मैं आपकी गर्दन में देखूंगा ठीक है. It is advisable to use a torch to flash at the patient's neck so that the pulsations are more visible or readily visible. And you do not look at a 90-degree angle. You look tangentially, like here, from here. And you look for any pulsations in the neck. Here you must remember that not every pulsation in the neck is JVP. It could be arterial pulsations and it could be venous pulsations. Now I'm sure you already know the difference between the two, but just to quickly review, arterial pulsations would be bouncing outward and venous pulsations will be bouncing inwards, and there will be two inward movements instead of one, like in arterial pulsations. There are also a few other characters to distinguish between arterial and venous pulsations, but it is out of the scope of this examination and I would like to proceed forward. Now, while you are examining the JVP, you ask for any pain in the patient's abdomen. पेट में कोई दर्द तो नहीं है? दबाऊंगा ठीक है. You press the patient's abdomen to look for any hepatojugular reflex. Now you proceed to examine their eyes to look for any conjunctival pallor, any jaundice. Look into their mouth at their mucosa to look for any central cyanosis, any dental caries, and evidence of any connective tissue diseases like any high arched palate. अच्छा, ऊपर देखेंगे? ऊपर देखें मेरे हाथ को नीचे. करें. जबान तालू को लगाएं ऊपर ऊपर. ठीक, शाबाश. Now we are about to examine the precordium. Again, look for any visible pulsations and ask for any pain in the chest. हाथ लगाने पे कोई दर्द तो नहीं होती? Now you localize the apex beat. दिल की धड़कन महसूस करूंगा ठीक है. You place again the basis of your fingers and like this to cover a large area of the chest and feel for any maximum intensity of the pulse. When you feel that, then you localize the maximum intensity with the finger to exactly localize, pinpoint the apex beat, the area of maximum impulse, right? This, the angle of Louis, feel that. Coming to left side, just below it is second intercostal space, third intercostal space, fourth and fifth. And then you assess whether it is medial to mid clavicular line or lateral to mid clavicular line. This is clavicle, mid portion, and it is almost in the mid clavicular line, right? So it is not displaced. In case if you cannot find the apex beat exactly, then after this step, you ask the patient to move to the left. And if you still cannot palpate the apex beat, then you ask the patient to come back to his original position, पीछे वापस आए, and then palpate in the right side of the precordium in the possibility that there might be dextrocardia, underlying dextrocardia. Now you look for any thrills, any palpable heaves, and you first of all again place here to feel for any thrill, like this and then like this. For heaves, you should place this here and look at the movement of the fingers. अच्छा, अब मैं आपकी दिल की धड़कन सुनूंगा, ठीक है? Now when auscultating the precordium, you feel for the carotid pulse while at the same time auscultating the precordium, and do systematically. First, auscultate the mitral area, which is left fifth intercostal space almost, and then move to axilla, left axilla, for any radiation of the murmur, if there is any murmur. Although you need to follow all the steps if you are in the examination settings. Then at the same time, you, after looking for any radiation, you ask the patient to move into left lateral position, and again with the bell of your stethoscope, you auscultate the mitral area. Then you ask the patient to lie straight, and with again you use the diaphragm of the stethoscope to auscultate tricuspid area, then Earth point, then P2 area, which is left second intercostal space, and then you move to right side, right second intercostal space to auscultate the aortic area. After having auscultated the aortic area, you auscultate the carotids to look for any radiation of aortic murmurs and also to look for any bruit. The final step in auscultation of precordium is you ask the patient to sit forward and auscultate the earth point to look for any murmur of aortic regurgitation. When auscultating the precordium, if you find any murmur, you can ask the patient and do any maneuvers like inspiration, forced inspiration, and forced expiration to look for any increase or decrease in the intensity of the murmur. जी मैं आपकी दिल की धड़कन सुनूंगा, आप ठीक है? Again, since the patient, since he is a normal subject, I'm not going to fully expose and assume that he is fully exposed. Your stat should be touching the skin of the patient in real life. Now you move to axilla and look for any radiation. come back to mitral area and with the bell of the stethoscope, hear any murmur of mitral stenosis and maybe ask the patient to go into left lateral position. In this step, if I press the diaphragm, it becomes bell. इस तरफ करवट बदलेंगे. आ जाए वापिस. Now auscultate the tricuspid area. Now auscultating the Erb's point. The P2 area, which is left second intercostal space. The aortic area, which is right second intercostal space. And now you auscultate the carotids to look for any radiation of the murmur or bruit of carotid stenosis. सांस रोकेंगे. ले लें. रोकें. उठ के बैठे. अच्छा, जब मैं ये रखूंगा ना सुनने के लिए, तो आपने लंबा सांस लेना, बाहर निकालना, फिर रोक लेना, फिर सांस ले लेना. ठीक है. This maneuver can increase the intensity of murmur of aortic regurgitation. The murmur of aortic regurgitation is heard at the Erb's point, and the intensity increases when the patient is asked to sit in forward position and at the end of expiration. ले सांस, निकाले, रोक ले. The patient is sitting. You can examine at the same time. You can auscultate their chest for any evidence of pulmonary edema or left ventricular heart failure, right? अच्छा, लंबे गहरे सांस लेने आपने. ठीक है. ले सांस ले. शाबाश. शाबाश. As the patient is sitting right here, you can examine for any sacral edema, but ask the patient, confirm if there is any pain in their spine. कमर में कहीं दर्द तो नहीं है? मैं दबाऊंगा. ठीक है. Assuming the patient is exposed fully, and look for any sacral edema. आ जाए, लेट जाए. Now you look for any evidence of peripheral edema. Having completed this examination, you thank the patient, sanitize your hands, and cover the patient.